All right, well, good afternoon, everybody. My name is Stephanie Hall, and I am with the ESRD National Coordinating Center. Thank you for joining us today for the ESRD NCC Patient Education Webinar event. This ESRD NCC webinar events are held in partnership with the Centers for Medicare and Medicaid Services. The call features patient and professional subject matter experts from around the country sharing how they or their organizations are coping with situations related to COVID-19. Before we get started, I want to let you know that this call is being recorded and will be posted to the NCC COVID webpage, usually within 3 business days. So let's take a look at the agenda for today. Today, we are pleased to have 3 leaders of kidney patient support groups. They will share how offering support and bringing people together assisted patients and families throughout the pandemic. The NCC recognizes talking about experiences during the COVID-19 or any sharing of healthcare experiences can be considered protected health information. We want to thank our panel for choosing to share, and we appreciate your interest in this topic. We will introduce everybody in just a few minutes. Our topic today is the benefits of support groups during the COVID-19 pandemic. After their presentations, we will have time for questions and answers. This does not mean you have to wait to the end of the presentation to ask your questions. As your questions arise, please submit them using the chat or the question feature throughout WebEx. Our goal will be to answer as many questions as time allows. I want to share with you a couple of new resources on the NCC website. The first one that you see there is called COVID-19, a positive test or under investigation being prepared. It's a brochure for in-center dialysis patients who have been diagnosed with COVID-19 or are considered under investigation. It offers questions to ask your dialysis facility and the cohort facility if you are eventually sent to a cohort facility. There are also suggestions for maintaining your emotional well-being. You can visit kidneycovidinfocenter.com and select for patients. The next resource we want to show you is a new COVID trend maps. It is developed by the ESRD NCC and the Kidney Community Emergency Response Program. The maps show COVID-19 positive cases rates among the general population and the ESRD population. Maps are organized by the ESRD network service area in color and are provided, you can be downloaded to print in color or black and white. The ESRD NCC encourages sharing these maps within your facilities, your transplant centers, and for all ESRD patients. So what's this call about? You will hear tips to empower yourself to cope with COVID-19. We will share some real-world experiences that you can put to use. We have some resources for you to use and share with others. And this series of call is available to you bi-monthly, offering a variety of topics. So I'll go ahead and introduce our panelists before we get started in our presentation. We have 3, as I mentioned today. And our first one, we have Debra Elmore. Debra currently serves as the Executive Director of the Bay Area Association of Kidney Patients in the San Francisco Bay Area. She has been involved with the BAAKP since 2007. Debra's history with kidney disease is multi-generational. It began with her father's discovery of ESRD, and later she and her sister were diagnosed with uromedullin kidney disease. Debra has a preemptive living donor transplant in 2014. Debra has owned her own consulting company since 1987, specializing in technical communication and project management. Her work in the medical field consists of projects documenting medical hardware, co-creating a knowledge base and with a pharmaceutical company, and multiple projects spanning 10+ years documenting call center processes for health insurance. We're also joined by Laurie Church. Laurie leads the only support group in the Twin Cities where she lives in St. Paul, Minnesota. Laurie was diagnosed with chronic kidney disease in 2008 and began peritoneal dialysis in 2021. Laurie received her altruistic kidney transplant in December of 2018. For 19 years, Laurie was a human resource professional in both nonprofit and for-profit organizations. She is currently a substitute teacher for middle and high school students. Laurie is currently obtaining her human resource generalist certificate at the University of Minnesota. She hopes to return to her career in human resources management field. Next, we have Janice Starling. She is a native Floridian from the city of St. Petersburg. In the year 2000, Janice was diagnosed with end-stage renal disease. She has experience with in-center dialysis, peritoneal dialysis, and in-home home hemodialysis. Janice received a kidney transplant in December of 2013. She is the founder of All Kidney Patient Support. She volunteers at her family-owned child care center. She is also a volunteer with LifeLink of Tampa Bay, which is the organ procurement organization, and is a trainer for Child Evangelism Fellowship Good News Club. Janice's lifetime goals consist of bringing about continued awareness, education, and advocacy about ESRD. What we're going to do is we're going to start off first, and I've got some questions for the panel. I think we'll just go around. And I think the first one, I'll just start with Laurie. What is the name of your support group, and can you describe its mission?
Well, our name is pretty general. It's the Twin Cities Kidney Support Group. And our mission is to provide insight, options, and pure advice to people diagnosed with kidney disease and their caregivers / significant others.
Okay, great. And I'll go over to Debra. And Debra, you're on mute.
Okay.
There you go.
Hi. I belong to the Bay Area Association of Kidney Patients, and we were founded in 2007, and our mission is to educate and support San Francisco Bay Area kidney patients. And we're composed of patients, family and friends of affected individuals, medical and ancillary professionals, and anybody that's interested in attending.
Perfect, great. And Janice, how about your support group that you're involved with?
Hi, I'm Janice, and the name of our support group is All Kidney Patient Support Group. All Kidney Patient Support Group is a patient-centered peer organization that provide non-medical support to those in need and affected by chronic kidney disease, which we call CKD, and end-stage renal disease, which is ESRD, and all other diseases that may lead to it. So we also have patients, family members, dialysis staff, and anybody that wants to learn about kidney disease.
Perfect. Well, Janice, I'll keep it to you, and I'll ask you, how long have you been involved in the organization, and why did you seek out a support group?
Well, we started with World Kidney Day way back in 2009, and we felt the need, me and two other patients felt the need to educate our community about kidney disease. And because I was totally, when I was diagnosed, knew nothing about kidney disease at all. And from that first onset of being diagnosed, I told the doctors I need to learn everything I could about kidney disease. And I was finding that more and more people in our community was being diagnosed with kidney disease. And we was at 3 different centers, and they was experiencing the same thing. So we started with World Kidney Day back in 2009, doing at Bayfront at our local hospital. And we started from there, and then we started doing support groups, and started from doing that. We found that the people that attended the World Kidney Day were people who also wanted more information and had the same mindset that we did. And so we started a support group, and in 2016, we became a 501(c), and now we're continuing to grow into the next level, into the next level, into the next level.
All right. Wow. Great. Laurie, how about you? How long you been involved in the organization? And why did you seek out a support group?
Well, I was diagnosed with CKD, chronic kidney disease, back in 2008. I seem like such a long time ago now. And at the time, I wasn't really looking for a support group at that time because I was stage 3. And really, I guess I was in denial at that point of time. But as time progressed and I became, I guess, worse and worse, in 2012, I crashed into dialysis because, hey, I'm not one of those people who needs dialysis. I'm, 40 and it's not going to be me. And total denial, got super sick, ended up in the ICU and all those bad things, didn't get a fistula, all the things you're not supposed to do. So, I started dialysis, peritoneal, in 2012 and was at rock bottom and needed to find some people who were like me. So I searched the internet for somewhere in the Twin Cities, and I really don't remember how I found this group, but there was only a couple people, and so I guess I found it back in 2012, and I've been with it ever since. And the reason I sought it out was I was scared, I was stressed, I was lonely, nobody understood what I was going through, and I just really needed some hope. So been there ever since, and am so grateful that I found this group.
That's great. Thank you for sharing that, Laurie. That must, I know it's not easy to say that, how low you got, but I mean, really, but, look where you're at now, and that you didn't give up. So, and you're hoping, sharing that with your story with others who can, again, we don't always want to admit to that. It's not easy to say these things. So I'm sure they are very thankful that you share your story and know that there's other people you've been there, and, it's okay, so thank you.
Mm-hmm.
I think, Debra, I'm going to ask you this question here. The COVID-19 pandemic really led to some changes in the way organizations have been run. How did the pandemic change the way your support group is running?
Well, before the pandemic, our support groups met once a month, but we rotated meeting places geographically so that we could reach more people in the Bay Area. And our average attendance at a support group meeting at that time was 10 to 12 people. When California got locked down in March, we had our first Zoom support group meeting on May 3rd, and we had 36 people attend that first one. And our average attendance now is about 23 per meeting. The main way that it's changed is that everything had to go online, so it's been great, though. We've noticed more interactions between people via Zoom. People seem braver to talk. It's been a good thing, but we miss meeting in person.
Of course, but that was a benefit for you then, and it sounded like you actually had a little increase in your, participation.
Yes.
Mm-hmm.
Yes.
Now, do you utilize the cameras so people can see each other, or is it left up to themselves, whether they want to?
It's left up to them if they want to, but yes, most participants are on camera.
Okay.
But they don't have to turn on their camera. When people call and ask, it's like, no, you can just call in. We don't have to see you.
And what do you think will happen? We know COVID is going to be here for a little bit, but what do you feel like? Will you stay and doing virtual meetings even after restrictions lift and things get back to normal? Yeah.
What we've been talking about, what the board of directors has been talking about, is because so many dialysis patients don't have the energy to drive. Here in the Bay Area, everything is like a half-hour drive away, right? We're going to continue to have one Zoom meeting, support group meeting a month, and then once we can meet again in person, then go back to rotating and having one in-person meeting a month. So we'll end
Okay,
up having two meetings, two support groups.
that's great. Great ideas. Janice, how about you? How has the COVID pandemic changed the way your meetings or support groups have been run?
Well, we were meeting, we was rotating also. We were meeting at the daycare center, and then we started meeting at the community center, the Daystar Life Center, where our last meeting we had, I remember we had a February tasting soul food. And that was our February meeting. And we cooked healthy soul food, without all of the fat and the lard and everything, just teaching people how to cook healthy food. So that next month when COVID hit, we were surprised, and we was already trying to do the Zoom at our support group meeting because there was so many people saying they couldn't come, they couldn't meet. So our attendance was around 20 to 25 in person, and we had maybe one or two on Zoom at the support group meeting. So I always had the Zoom available before Zoom was really Zooming. And so after COVID, we started with doing our meetings virtual altogether, and it averaged between 15 to 20 people. But one of the things that I noticed after the meeting, once we go over all of our educational, we have a time where we turn the cameras off and we just say who has a question or who likes to talk, or we kind of use it as an open floor. And that part of the meeting is just so rich with conversation from people opening up. And one guy was on, and he had just became a transplant recipient, and he was afraid, and everybody chimed in and we supported him. And then at the end of the meeting, he ended up encouraging somebody else. So that was a great thing. But wanted to make it short now, what we've done is we've started doing food distributions once a month in place of our meetings. We still do the Zoom meeting, and we do a food distribution. I partner with the Daystar Life Center, and we started doing healthy food boxes because people was having trouble getting food during the COVID times.
Yeah, sure. Yeah,
Yes.
yeah. So Janice, while you're still got you there, so have you had some challenges with moving the meetings to online, with people trying to
Yes.
have connect or to have the access to, computers or iPads?
Yes. We have had a lot of people. Some people are not. And Florida is a retirement state, and most of the people on dialysis are 50 and over. But it is changing. The dynamics of dialysis is changing. So trying to get the group to know how to work the Zoom is one of the challenges that we have. Before COVID, I would actually go into the center and try to sit down during the dialysis treatment and try to show them how to download it on the phone. Because some people say, I don't know how to do that. I don't know how to download it. Then one person say, I was on, I don't know how to use the passcode. And then one person say, well, I don't have internet. And it's like, well, you can call in and just listen, or you could, and I have to tell them, just like a prayer line, you don't have to show yourself, but you can still listen to the information. So it was a challenge, and it's still a challenge today trying to get people to call in. And then with the cell phone, I can't see, I'm swiping and I don't know what to do. And so it's a bit of a challenge.
Yeah. And how about you, Laurie? How has the pandemic changed the way your support group has ran?
Significantly, as everyone else, we were meeting in person, which was always so much fun. Actually, right at the time of the start of the pandemic, we had lost our space for where we were meeting. We were getting free space, actually, ever since I had joined the group. We had gotten free space in this, it was called Vision Loss Resources. for the legally blind. So they had folks that came there. And I don't know how we ever got the space, but we always had a room, and they would always give us free coffee and water. I don't know whoever bargained that out, but it was awesome. And so we lost our space. But anyways, as many of us were at risk, high risk, we stopped our meetings altogether, and we're kind of like, what are we going to do now? And so we started doing the Zoom meetings. In the beginning, actually, we started just doing emails, just checking in on each other, because everything was shut down and everybody was just kind of lost at that point. And we're just worried about their families, worried about their kids with school, and their health. You know, we didn't know what was going on. So it was just a couple of months before we actually started doing Zoom. And then, you know, if you do it free, it's like 40 minutes and you're cut off. And we're like, oh my gosh, let's restart the meeting again after we all got cut off. So then we actually decided we had a person in our group who had Zoom for her business. So she let us use her Zoom account because our group doesn't have any money. We're totally not funded. We get money, like my church provides all the copying services for our group. We just rely on donations all these years, so we have no funding. So we did go to Zoom. We're having our meetings every Thursday, every third Thursday of the month, from 12:30 to 2. Now we have them more often, so we have them every other Thursday from 12:30 to 1:30, and so people can join whenever they want, which has been awesome. So it's happening more frequently, and it's just been more available for people.
Right. Thank you.
Mm-hmm.
Yeah. So Deborah, can you talk about some ways that you supported your members during the pandemic?
Mainly through the Zoom support groups. We've made ourselves more available via email. So if people email questions or reach out for help through our info at baa.kp email address, we have a phone number, and people call. Actually, that rings in my house, and try to direct them to resources. And our president of our group, and he leads our support groups, has been great at reaching out to people. He'll just call up some of our members, and ask, how are they doing? What's going on? So we've just tried to stay in touch more.
Mm-hmm. Right. How about you, Janice? Want to talk about some of the ways you supported your members?
Well, during COVID, like I said, we started the very next month doing a food distribution in March. We started doing healthy meals just for kidney patients and their families and friends. So we started the Zoom meetings, and we also started doing once a month food boxes where we would provide zucchini, strawberries, chicken, any types of healthy food that kidney patients can eat. So I will work along with the dialysis social workers. I will send them a flyer, and they will give the patients the flyers, and the patients will contact the support group, which, like she said, my phone. And now we just have it where they can register online. And then from there, at a certain time, the third Thursday in the month, between the hours of 4 to 6, they drive through, and we put the boxes in their car. We say hello, and we drive off, and they kind of, I have face-to-face contact with each patient that comes through.
Janice, where do you get the food from?
Well, the Daystar Life Center, they started providing the food for us. So they started first. Then we had a We Care Tampa Bay. They also provided a couple of people contacts. I found out they started giving us food. The St. Pete Free Clinic, they also will, from the daycare, I would donate some of the food there. And then we received a COVID grant from one of our community foundations. And once we got that grant, we was able to really do kidney-friendly food. We gave out salmon, lamb, and during Thanksgiving, we gave out turkeys. And we had a couple of our nephrologists, they gave us donations to also help because they wanted to make sure that the patients was eating healthy during the pandemic. And one of our patients that picks up on a regular basis, he said, Janice, I must tell you, my albumin is high. He said, all of the meat that you've been giving me, and I've been able to keep my albumin high. And I really have to say thank you, because by the time I pay my rent, your food is the only food that I have. And because you give us the great meat, you give up so many meats, I'm able to, keep my albumin high. So he just told me that last week. I felt so good when he said that,
Wow.
to let me know that his labs was a result of the food that we give him.
Wow. That's wonderful. Wonderful.
Yeah.
Makes you, it's all well worth it then, isn't it?
Yes, it is. It is.
And I've heard a little bit more about these, starting these food distributions and stuff. So what kind of advice to the people on the call today can you give them if they're interested in maybe starting something like that in their area?
Well, first of all, they have to get in touch with a local food bank in their area and see if they're willing to donate food specifically, because when you do food banks, they have like a standard spaghetti, tomato sauce, ground beef, a chicken. It's like a standard package that they give, bread, everything that's not healthy for a kidney patient or a person who's on dialysis or a person with hypertension. So those are the things that it's like a standard kidney box. I mean, a food box that they give. So I would advise someone to contact their local food distribution or what is it, Feeding America? If I see the wheat, the grain of wheat, and see if you can talk to them about streamlining the food choices just for kidney-friendly patients or a kidney-friendly diet. So that's what we
Okay.
started, because I had to educate the Daystar Life Center. I had to educate them first. No, I can't give out this. No, I can't. I can't give out sweets because we're dealing with people who are diabetics, and we're dealing with people who are trying to, I don't want to be responsible for helping someone, have a sugar spike.
Yes. Yeah. Good. Well, thank you. All three of you come from very different parts of the country. I follow California quite, even though I'm from Tampa, Florida, I follow California quite fairly closely. So I'm going to ask Debra the next question. It's been more than a year since we all, were told to either go home, restaurants were closed down, we were told to social distance. What were some of the challenges you and your members faced in your community?
I think the people that I've in the support groups that we're talking, a lot of them, it was isolation because, we were stuck at home. We were scared to go out shopping. So shopping was an issue. Luckily you could have groceries delivered, but I would say not being able to shop for food and isolation. And then for our group, it was not being able to distribute literature to dialysis clinics and doctors' offices, because they quit leaving literature out in waiting rooms or all the meetings were virtual. So it's been harder for us to get the word out about our group.
Yes.
Yeah. All right. How about you, Laurie? How about in your area? How about what challenges did you and your members face in your community?
Well, Minnesota has many challenges with weather.
True.
Being one of them, along with protests and
Yeah.
verdicts and all kinds of stress and pain in our community. But yeah, we had the same things with being isolated, and I had a couple friends that would bring food for me. I still, like this morning, I still go out early in the morning to get my groceries, even though I'm vaccinated and whatever. I guess I've gotten in the mindset now after a year of all this that, we can all change, we can adapt and get used to these things, but yeah, it's scary times. So I guess the challenge for us was just the unknown, because we have these underlying conditions, and when the TV keeps throwing it in your face, people with underlying conditions, people with chronic kidney disease, and I talked to my transplant center. That's who I went to for my information and just said, look, what do I do? And they're like, just keep taking your meds and wearing your mask and social distance, just like we're telling everybody else. So I just listened to my transplant center in doing the same thing. But some of our members just were very panicky. I have members calling me all the time just to talk and how stressed they are, and they don't know what to do. They're just really very, very scared to go out anywhere. And I understand that. I waited 6 years for my kidney, and, I don't want somebody who breathes on me and is ignorant or whatever and doesn't wear a mask and I get sick. I get stressed by other people's ignorance. So, yeah, we in the community are faced with that, especially if people don't have underlying conditions and don't understand our pain or the suffering that we've gone through as patients. So I get a lot of calls on that. And many of us just do takeout or just have groceries brought into our home or go at early hours. So we've just adjusted.
Hmm. Yeah, isolation certainly is probably was the number one,
Mm-hmm.
you know, change for all of us, and even for, ones that didn't have underlying conditions or, and there was so much information out in the media that you just were in overload. And that was the other thing. Who do you trust? And I hear you, Laurie, saying you went to, that was the
Mm-hmm.
good thing to do. Go back to your transplant, program, get what they recommended, follow their advice. So it's good.
I just wanted to add, can I
Sure.
just add one other
Oh, yeah,
thing?
absolutely.
I think another thing with our group was the fact that we couldn't see our family members, that we were isolated. So in our group, on our Zoom meetings, we talked a lot about that, where we could see each other, and we got comfort from each other because we're like a family. We've been a family for a long time because many of us come to our group. We're all the same ones generally. So we're like a family. So I hadn't seen my dad in a long time, but, 2 weeks ago he died of COVID. So it was like, oh, dang, it's like, oh my gosh. It's just like you're affected by it. And then you're like, and then several members of our group had family members that passed, and had to say goodbyes in the hospital or were in the hospital and couldn't have the family members there. So I just want to add, our support group was really helpful through those times when we missed our family, because we are like a family. So that's one of the wonderful things about having a support group. So I just
Good.
wanted to add that.
Thank you. And I can't even imagine what that would be like. Yeah. Can't even imagine. So thank you for sharing.
Mm-hmm.
Janice, I'll go back to you. What advice do you have for people who are not on social media or that do have challenges with technology? How can they stay connected and receive support during this time?
Well, one of the things is trying to communicate with the social workers at the dialysis center. And you have some social workers that are really great at what they do. And when I send an email to them, they make sure they get the information to patients that are not tech savvy, and they make sure that they, some of the people that we serve our food to. Um, I was like, okay, can I text you? No, dear, this is my landline. And they'd be like, oh, okay, all right. And so, and I have to remember that people still have landlines. And so, but the social worker is very good at getting that information out to the patient. So I'm kudos to the great social workers that we have in our dialysis centers. But it's just word of mouth. I don't know. I try to tell someone else. St. Peter's a little small knit community, and I feel very. The one that was talking about the social distancing. I mean the and being isolated. A lot of the dialysis patients that we were dealing with, they were having issues with wearing the mask in the center. I mean, we received so many calls. I don't want to wear a mask, and I don't want to wear this, and I don't, it was just so. And then one person say, "Well, I want to wear my mask," but the other person is not wearing their mask. So we had so many. I was trying to stay in touch with the representative from the NCC and letting them know that, hey, these people are complaining and they're trying, what can we do? And trying to let them know that you have to wear your mask. And then somebody was calling about if the masks are clean. And it was just a lot of people that were in center that was really calling us and trying to deal with that first month or two and that third month. And then once things settled down, they became, a little bit more adaptive. But people who that's not used to technology, pretty much it's just pretty much word of mouth, because like she said, we can't leave the flyers. I can't go by the center and say, hey, give this out. So I have to email it, and then it's up to someone in the center to give it out. But there's it's just hard.
Right. Um, Deborah, what has been the greatest lesson you've learned since the pandemic started more than a year ago about the value of staying connected with each other?
I think it's built a lot of trust and friendships.
Yes.
In some ways, we've gotten closer to each other through Zoom, which sounds, counterintuitive, but I think our members now trust us, the leaders of the support group of BAAKP, more because they see us, so to speak. They're able to join us, without walking into a room. I don't know what I'm walking into, so they can, check it out on the phone first and then, show their face later, that kind of thing. Personally, I found out how supportive my neighbors and my friends were. People that would shop for me, that would ask, do you need anything at the store? So in spite of the isolation and being alone, it's built up more of a community.
I agree.
Yeah, I was going to say, I just on a personal, I mean, you're right, getting to know the neighbors, right, live right next door to them for how many years, and you don't ever take the time to, you know, get to know them. And this certainly, I think gave everybody the opportunity to do that. How about you, Laurie? I mean, you've sort of shared a little bit of your lessons learned, but
hmm
what about the value of staying connected during this last year?
I think one of the biggest ones is socialization is crucial. Um, Even if you are more of a homebody or just a person who likes to be by themselves, I think you still need something of a socialization of some sort, especially when you have a chronic disease. I know I do. I thought I didn't in the beginning. I'm just very independent, and I'm like, oh no, I can handle this myself. And I come to find out that no, I just really am lost. So I find the lesson especially during the pandemic, is that I dealt with, I kind of hit rock bottom again during the pandemic, which I thought I was stronger than that, but I have to admit, I'm not. That I went through depression again and just feeling really like I don't know if I can make it through this. And honestly, I I had to reach out to my doctor and say, I am having some dark thoughts here and I need some help. So that took a lot for me to do, but I've gotten older and wiser. And so my doctor, helped me through that. And they're like, we're seeing so much of that. And I said, I'm just so anxious. And then I talked about it with my support group, and a lot of people had the same feelings.
Mm-hmm.
And we then started having our conversation about grief, because what I hadn't realized was that when you talk about grief or go through grief during a chronic illness, especially kidney disease, since there's no cure, that you can go through grief many times. And I was really upset by that because I'm like, no, I want to go through my stages and I want to be done with this. I'm very OCD and I don't want to have it again. And people are like, oh no, I've had it a couple times. And I'm like, you have? And I'm like, so have I. So I think that common camaraderie thing in a support group is so helpful. So after I shared that I was having issues with being depressed and just grieving again, grieving a loss of seeing people, grieving going out, grieving everything of this loss of the pandemic, I just found that to be a great lesson, and very grateful to have my support group.
Thank you. Thanks again. I just want to pause and just remind the audience if they have any questions. We are kind of, we're got about 15 minutes left, but just want to remind the audience if they have any questions for our panelists to please submit them, or comments, or just anything, just submit them through the chat. We'd love to hear from you. And Janice, how about you? What's your big lesson learned about staying connected with each other?
My big lesson learned is that people, like, they really need someone to talk to. They really need a way out. Like she was saying, the loneliness, the texting. Even when we text each other, that was a form of connecting. Even when we do I started doing the support group in 3 different group texts. And someone would say something, someone lost and oh my God, when you was talking about the grieving, my heart just went out to you, because Laurie, I think that's Laurie, right?
Correct.
And
Yes.
my heart went out because you do go through it multiple times, and you just have to stand and just remember, hey, I'm through this phase, but tomorrow I'm going to keep going. I got to keep moving. And even patients in the center was saying when they lost someone next to them, they were saying such and such isn't here anymore. And, what do we do? And, we had to, how do we handle, are they gone? Are they in the hospital? Or are they gone for good? So that was something that we had to deal with. Also, how to communicate in the dialysis center because of HIPAA. They still have to figure out a way to do that. So loss was everywhere, like you were saying. It was just everywhere. And then somebody even lost their service animal, and that was a big group text, and everybody was texting back and forth, and and it gave the guy who lost their dog a chance to heal. And it was like, okay, he wasn't able to come and pick up his food box. And I said, we had got some ice cream in, and I said, I know he doesn't need ice cream, but when you lose somebody, you got to have some ice cream. So I took him. I didn't take him to big. It was a low calorie, but I took him to Haagen. I did take him to Haagen-Dazs. It was a little quart size, and he was like, "Oh my goodness!" He said, "Thank you. Now I can just." I put all of my sorrows in this spoon of this ice cream. I go to dialysis tomorrow. He said, but you just don't know how much you helped me with this ice cream.
Oh my gosh, that is so good.
So he was just so happy, and he was just so thankful that he's like, you just don't know. He said, because he said, I've been crying so much, I can't even see the drive to come pick up my box. And I say, well, I will bring it to you. And I slipped, like I said, I slipped a couple of ice creams in there. And he was just so happy to sit there and, with his sorrows and his ice cream. So ice cream is a good thing. Laurie, get you some ice cream, but wash your hands, don't wash your hands.
There you go. There you go. Well, we did have a question come in through the chat. It doesn't have a specific name. I will just put it out there if anybody would like to answer that. That'd be fine. What measures have your support groups used or done to ensure that you reach a diverse audience support group participants, such as age, race, etc.? Good question. Does anybody speak to that?
I'll start.
Okay.
We have a survey, and well, I did a survey in the food line, and because that was the only way I could do it, and I had to have someone answer the questions as they was driving. So while somebody was getting their box, I did the survey through the line, and from the survey, I kind of learned about the demographics of the people that we serve. So that's one way. And like I say, going through the dialysis center and dealing with the social workers to allow them to make sure that I serve, everyone is one of the ways that we do it. So a survey, and then one of the things is getting the information back from the survey. Even when we do a Zoom call, some people, they're not click on the link, and it's like, okay, I don't know how to click on the link. So that's another thing too. So, but surveys.
Good. Debra, Laurie, any other?
This is
Go ahead,
Laurie, and to piggyback off that, when we were able to, hit the street, so to speak, and I did a lot of that where I take up my pack of flyers and pick a bunch of dialysis centers and just go to several each day and meet with the social workers and say, hey, have this support group. And so got very well known in the Twin Cities area here. And still people call me, and what I have done, hopefully they're still talking about it in doctors' offices, but I wrote a letter to the doctors, the groups of doctors, and just said, this is who I am. This is what my summary of who I am, so I know what this is and can speak to it. This is a support group we have, and since you're pretty much the first point of contact, since you're the doctor, would you mind putting this in your office, or at least speaking about it? Because they're talking to you at the moment. They may need a support group because they're getting hit right on, like you've been diagnosed, and they're freaked out and they have fear. Just give them the flyer. They may not come right away, but at least they have it. So I sent that out I tried to hit every doctor's office in the Twin Cities, and the hospitals, the transplant centers, whatnot. And we have a pretty diverse group. So I can't really say how effective the flyers are or the outreach is, but I get calls all the time of people just curious about it. Even if they don't come, they're still talking about it. So I haven't done any surveys. I guess I wouldn't even know how to do that really to reach people. But like when I was at my dialysis center, I mean, people would run from me because they're like, I don't want to go to a support group. It's Laurie Church. Oh no, because they're like, I was just really hyper about it and very excited about it and said it's really fun and I think you'd really enjoy it. But yeah, I think it all depends. Just getting the word out there is how I've done it, and tried to get it on the websites like National Kidney Foundation, and just getting out there so when people search like Twin Cities support group or something like that, it pops up on their computer. But the diversity part, I don't know, maybe you guys can help. I'm not really sure how to.
Yeah, good question. Debra, do you have
that.
anything? Yeah, Debra, do you have anything to add?
I wish I had the magic answer. we do the same thing. We do mass mailings, like when we have our newsletters or our flyers to dialysis centers, and we have some doctors on our distribution list. We send out emails. We have a couple of doctors. Laurie, you're right. Doctors referring people is a great source to help diversify. What I wish we could, a group I wish we could reach is younger people, because
Hmm.
most of course, most dialysis patients are older anyway. But you have a 20-year-old come like once, and you can just see it on their face. It's like, oh, this is a bunch of old people. And I wish that there was a way, to bring young, because I know that the patients are out there. So, but just the regular channels,
Good.
email, dialysis centers.
Okay. Well, we're getting close to, but I do have one question I just want to let everybody an opportunity just to respond to, because I think it's a real good question. And Debra, I'll just ask you first. Are your members of your support group discussing the COVID-19 vaccine, and what is the conversation like?
Yes. And the
Good.
primary question has been, have you gotten it yet?
Okay.
And does the BAAKP suggest that you get it? And we found that transplant patients overwhelmingly said, yes, give me that shot. CKD and dialysis patients are a little more hesitant because they're scared it's going to interfere with their kidney disease. So, but it hasn't been as much a discussion of if, it's been more of a discussion of, have you gotten it yet, when?
Good. Okay. How about you, Janice? What's that
Oh,
discussion?
that has definitely been a conversation. Most of us was like, have you got it yet? Okay, well, how did you feel? You know,
Yeah.
we had, it was so funny, one support group meeting, everybody like, okay, who had the shot? Who hasn't had the shot? Okay, tell me, what did you feel like? How did you feel? Okay, did you know, did your sister get it? Did your cousin? I mean, we was
Yeah.
so
Good.
we was really, yeah, we was that was a conversation, and then I told him I had it, and I said I got both of my shots. So when I said that, a lot of other people was like, okay, you're okay. So now I know I can go get mine. So it was
Right.
more of a you go first thing.
Yep.
So, but
How,
that was a conversation. Yes.
good. How about you, Laurie, in your support group? Discussion been around
um,
COVID vaccine?
oh yeah, yeah. And what we talked about was the pros and cons of the vaccine, and absolutely the various stages that each person in our group is experienced, because we have pre-dialysis, we have dialysis, we have post-transplant. So all that was talked about, but we also talked about the priority. Like, well, are transplant patients going to get it before dialysis patients?
Yes.
So we talked about the potential of jealousy, which as a teacher, I got one of the first ones, even though I'm not over 65 or anything. So the biggest challenge we had in our group was not alienating members for their beliefs due to the misinformation out there on the internet and polarization of the topic, and just their personal perspectives on vaccines in general. So we just really tried to be open. People have their choice. And lucky for me, I had a reaction, a Zippo to either one. So yay. And I had the Moderna. So yeah.
Same here. One more thing, Julie. One of the things that I did, I had a speaker that was a kidney transplant patient, and also worked in the dialysis center as a tech with the water system. And he was a person who had COVID, and also was, transplant recipient, had COVID, and also got the COVID shot, both shots. So we had him come on. So he answered a lot of questions because he was a transplant patient. He was a kidney patient. He was a transplant patient. He was a worker in the center, and he also had COVID, and he also had the shots.
Wow.
So,
Wow.
so he was able to answer a lot of the questions for everyone, and that generated a lot of questions in our support group meeting when he came on and spoke that day.
Well, thank you. I want to thank all of you for joining us today, Laurie, Debra, and Janice, for sharing some personal, some of your personal experiences, with the great work you're doing in your support groups. It sounds like you all are doing great work out there, and we'd like to see more of that for sure. But again, thank you so much for being here, and I'm going to have Matt take me to my next slide. Just a couple things before we close out. I'd just like to share a few recently added resources to the NCC website. One is called My Plan, My Care. It's a tool to help you partner with your care team during your plan of care meeting. It offers a list of topics to discuss, including important questions to ask about your dialysis health, emotional health, and vaccinations. There is also a page to take notes on your visit and write down any additional questions you might have. You can visit www.esrdncc.org/patients and select for new patients. Then look under the being involved in your care category. Next slide. Two other resources that are helpful as you begin to prepare for maybe travel, when you begin to feel comfortable traveling again, of course. This tool are for those who use in-center dialysis or home dialysis and are planning a trip. Learn how to plan, what to pack, and discussions to have with your care plan. They are also travel tips to help along the way. Visit again www.esrdncc.org/patients, then select for new patients and look under the traveling on dialysis category. Next slide, Matt. And then just as a reminder, everybody, about the kidneyhub.org. It's a mobile-friendly web app developed by NCC with lots of input from our patient subject matter experts. It has information on home dialysis, kidney transplant process, infection prevention, and mental health, and a lot more. A diet and nutrition section was recently added, so check it out today. Next slide. So we invite you to mark your calendars for the next COVID-19 webinar events. Our next provider focused event is May 5th at 3 o'clock, and the next patient focused webinar is scheduled for May 11th at 4 p.m. Eastern Time. Please watch the NCC website in your email boxes for registration information. So again, thanks for our panelists for being here. Thank you all for joining us this afternoon. For any additional COVID-19 resources, visit the KSER website at ksercoalition.com. And thank you, everybody. Have a good evening. Take care.